Thank you, Ernie. Red, White, and Blue will now address the Democrat versus Republican view on President Barack Obama's health care plan. Welcome to Red, White, and Blue. From the right, I'm Gary Polland.
And from the left, I'm David Jones.
Tonight, we welcome a number of significant guests. State Representative Sylvester Turner, Democrat, but we still like him. Ed Hendy, radio host, KSAV AM 700, conservative, we really like him. And Clifford Fry, PhD, Executive Vice President at RRC Inc., an economics consulting firm. I guess you're the egghead here. Welcome to you all.
Yes, welcome. And who the we is in this, I don't know. All I know is that the President of the United States changed the deal in the last 24 hours. This is now a problem about 46 million Americans who don't have insurance. It's about 12 million who are discriminated against by the insurance industry because of pre-existing conditions. It's about the 14,000 a day who lose their insurance, and he says that's a moral problem. How do you like that analysis?
Well, I mean, I agree with the analysis of the 46 million without insurance. Let's not lose sight that there are about 9 million of those that are children. And right here in the state of Texas, you got about 1.4 million kids without insurance at all. Between California, Illinois, and Texas, we represent 45% of that total population without insurance. Those are significant numbers.
So if we solve it in Texas, we go a long way to help solve the problem.
Yeah, without question. I mean, Texas is number one in the number of kids without insurance. In terms of numbers and percentage, we are number one. Those are not good numbers. But the reality is, from a moral vantage point, there are children, there are adults who are having to live without it. They are being affected by it. It's in every community. It covers the spectrum. And from an economic point of view, there are tremendous economic losses that are taking place. Businesses are hurting. I have a small business. I mean, we are providing health care insurance, but I would tell you it is cutting into our bottom line. And so the question is, and many of these people are working people, okay? They're coming from working families. And so the question is, how do we address it? And what's the responsible way to do it? But it is a moral issue. It's an economic issue. It's a societal issue. And it's a financial issue.
But isn't it just a political issue, Ed?
Praise God. We've got a Democrat on record right here that has actually enumerated the real problems of this program and has said, let's actually figure out what we're going to do. I'd like to point out to my Democratic friend that your party wanted to cram a 1,018-page health care solution down our throats before they ever came home and talked to the people. Your enumeration is absolutely bang on. You're right. The problem is the solution doesn't resemble anything to do with the problem. And the alleged 47 million that are uninsured, you can't find one person in this country that's untreated. Not one person is untreated, which means they are being covered and they are being treated and we are paying for it collectively.
True.
They'd all like to have an insurance card, but they don't. They got to go down to the county hospital and wait in line. But the fact is they're all treated. Now, the solution needs to be, let's address the whole thing. Let's back up and start the whole thing. If you and I could write a better plan than that piece of garbage that's been floated in the House of Representatives.
Well, let me just say, what we're dealing with now, though, we're dealing with concepts, not necessarily with the plan. I think we can all agree that the present system is unsustainable. It's costing too much. There are people, they're receiving health care treatment, but I would tell you, when a child goes to an emergency room, they're paying a lot more. The costs are considerably higher. Who's paying that cost? The costs are coming from people with private insurance. Their premiums are higher. The costs are being paid for by property owners. They're paying more. And so the system under which we are presently operating is unsustainable. At least if we can agree on that, then I think we can then say that the status quo is not acceptable. And where do we go from here?
Maybe Mr. Fry, who's an economics PhD, can tell us whether or not we can afford to have everybody covered.
Well, I would agree with Mr. Turner that the present system could be improved. But I think that there is a serious choice. first of all, you mentioned these are the reasons why we're pursuing this health insurance. I've heard also keep insurance companies honest. I've heard cut the growth in care. But if you look years past, this is a long-standing objective of the Democratic Party. This is just the current reason. And we have to, as a society, decide how to improve our current system. And the current system is a combination of government regulations that actually prevent competition in many ways, and the market. And what the government wants to do is go toward much more a government-controlled system and a government-dictated system versus going toward a market system. And both ways, I prefer the consequences of the market system, because you have free people making their preferences in a marketplace based upon true cost. And the other side of the coin is going toward a government system which is basically implemented by force, which the government will tell you what you can get, when you can get it, what doctors can be paid providing it, and it's a very
So you think whenever you're sick and you're vulnerable and maybe you don't know what's wrong with you, and you may be dying, that you are an effective consumer in a market decision?
No,
are you really seriously thinking that this is a market that we can accept the consequences of those types of decisions without regulation?
As Mr. Hendy said, they're getting care. This is a decision about whether or not to go to a system that denies health care all around the world in huge waiting lines and refuses expensive treatments, refuses all kinds of treatments of all kinds of people. And we have to recognize what this is. This is a government system that will impose tremendous cost on all of us and take away choices of all of us. The market, it is a market issue.
But let me chime in here. When we talk about a government system, let me take issue with a few of that. It is not the government program, for example, that's dropping 14,000 people from their health care every day. That's not government. Those are private insurance companies that are doing that. It is not the government, for example, that's denying coverage to people from a pre-existing industry. That's not the government. That's the private industry. It's not. Let me just finish. It's not the government, for example, that says that when people have paid their premium and then all of a sudden they become seriously ill, that they're being dropped from their government. From their policies. That's not the government. That's private industry. And then lastly, and I just thought about this when we said
There's
that
a lastly in my future. I can't believe it.
When we said that people are getting health care, I'm going to differ with that, because even in the state of Texas, we have a Medicaid system. We've got the CHIP program, for example. But there's a lot of wrangling that's taking place if people think you qualify for one and you don't get the other. And as a specific example, because I like to deal with factual information, there was a young guy in my church, for example, Dante Johnson. Mother works, had cancer. She tried to get him enrolled on the CHIP program. They said she didn't qualify. Said that she was making too much for the Medicaid program. For 4 or 5 months, this kid went without any care at all. Didn't get any. Until they contacted my office. We started dealing with the process, finally got him enrolled, but a few months later he died. So to say that there are not people who are not getting care, it's not true, because we have a bureaucratic system in many ways where it's difficult for people to jump those hurdles because they can't afford private health insurance. And then they're having to deal with the government bureaucracy.
Can I write you a check? You just made my point.
Well, but the point is that
get to the end of your point so I can jump all over.
That there are many people who do not have it. I believe in the free market system. I believe in that.
You're now filibustering.
But
let me jump in
because
here.
they're getting subsidized. They're getting $177 million from.
You also believe in Santa Claus and the Tooth Fairy.
Let me correct you, Sylvester.
Okay.
Number one, you said that's it's not a government program that drops 14 million people. I'd like to point out it's a public program that insured them to begin with. You just said that the CHIP program and the bureaucracy couldn't take this kid in. Now, if you couldn't get this kid some help at Ben Taub or Texas Children's, you call me and I'll take you down there, because I know they do it every day. I've seen it in my own 2 feet. I've sat there with the kids that are sick, that are in there being cared for, unable to pay. It goes on every day. Memorial Health Care, Texas Children's, Baylor Medical Care. We can line them up from here to the Gulf Freeway, the line of cases they take, and never get a dime for it. I know that's false. Secondly, if you think the bureaucracy is bad now, you're now going to expand this program and turn it over to the federal government to run, and it's going to somehow get better?
Well,
You got to be kidding.
and the reason
look, Sylvester, look how they did on the Cash for Junkers program that was supposed to last till
A
November.
program that-
lasted 2 weeks.
but a program that has done exceptionally well. The demand has been far greater than anyone anticipated.
And that's what's going to happen when you give more free stuff.
this morning. The dealers haven't been paid.
Well, no, the dealers
They're
have
making new cars,
No,
though.
the dealers have decided that they're not going to provide this offer to additional people. They're waiting
No,
on
they
their
haven't
check.
been paid.
They're waiting on their check for the many cars that they have already sold,
exactly.
and that the automobile companies are now building more. The point that I want to make
dealers
is
are going
that
broke.
I support the private sector. I support the free market enterprise system.
But we don't have that now.
But let's recognize that the status quo, under the status quo, millions and millions of adults and children are without health care, or at least without getting it on a timely fashion when they need it. And that there are millions of people with health care, just like us. We have private insurance, and our premiums are higher because of the number of those who are uninsured. My property taxes are higher
But you don't wanna
because of the
move.
situation that exists. And that the status quo is not sustainable.
But you don't want to move toward a monopoly system dominated by the government. If you believe in the private enterprise system, you make it where we can buy health insurance across state lines, and therefore make the insurance companies competitive. You have tort reform that lowers the defensive medicine
I haven't heard
costs.
that a zillion
But let me
times.
tell you the structure problem that makes it not a market
Did we-
system like David was
Did
talking
we not
about.
impose tort reform in 2003 in the state of Texas?
We go into a doctor's office and we pay a $20 copay for maybe a $200 service. What needs to happen is catastrophic insurance, many choices by consumers to make the insurance industry more competitive, and allow us to go in and actually decide what medical services to get based upon the true costs of them and our true
Now, that
preferences
sounds
and
like one of
risks
those.
for
Those sound like those death panels that
No.
people have been talking about.
The death panel-
Is that,
Hey,
what,
Dr.
is that,
Violet,
is that what you're saying?
Let's address
the
it. Let's
Democrat
address
brought it up.
Well, I brought it
There
up.
you go.
I brought it up
brought it
only in the sense that it is interesting that we have people who are criticizing this plan that's been put forward. But Cliff, what I'm hearing you saying, you're wanting a panel to come in and determine what's good health care and what's not.
A panel?
He never said panel. You
Well,
did.
Panel?
what
No.
I'm-
A
you-
panel
Best
is the
practices.
government.
Best practices.
Now, whether you call it panel, whether you call it best practices, the reality is,
I did
can
not
we
say
all
anything like
can,
that.
Can we all agree that the present system is not sustainable?
Well, we
Well,
can't
let's get
afford
it.
it.
Yes, no. Yes,
Can we
no.
all agree that the proposed bill doesn't address the very specific
No.
issues you laid out that I agree with?
But I-
Will you agree
Actually,
with that? Yes or no?
what it
There's
does.
not a
So yes
it's a-
or no,
it's a-
Sylvester?
there are
Do
concepts.
it. Do it, or we're going to the floor.
There are concepts. I think there are concepts that are
Does
being
the
put forward.
current bill
Which
address
one?
those issues?
But
That
which
one that's
bill?
in the House, the 1,018 pages that's been on the,
I'm sure
on
you
the
haven't
internet
read
that
it.
you haven't read. Along with
Y'all can take it
John
outside.
Conyers.
Now, I want to ask Dr. Fry. Dr. Fry, is there? I understand that you're a Republican. I can tell from the way you talk. I know you've been invited to talk to tea parties around our area. Now,
From the
what's
economics of this program.
Give me the Tea Party solution to the healthcare problem. Give me the Glenn Beck.
I can give you the economic
Can you give me the
solution
Glenn?
to
Can
it,
you give
in
me
my
the
opinion.
Can you
and
give me
that-
the Glenn Beck solution? Can you give me the Sean Hannity solution?
Let
or
me
the
give
Tea
you
Party?
the economic solution. If they want the other solution, they can tune in. But the economic solution is to make this function more like a market. Let me tell you, there
Whose
are,
bill- I
there are
just wanna
apples
know
in every
whose bill is out there,
Oh, there-
Mr. Fry? Who's sponsoring
there
the
is-
bill? Who's
I
sponsoring
have
the
no
bill?
idea. It wouldn't be considered anyway.
Okay, so you don't have any
Well,
friends.
no,
in
actually,
I have-
there's
I
a
have
bill. There's
the
the
elements
Republicans. The
that should be
Republicans
there.
have a bill in Washington that in
It's
the
not
Senate.
being considered.
No, but it's a bill that gives refundable tax credits to individuals and lets people then buy insurance, allowing competition among the states and reducing requirements what these policies require.
See, if you
it's
allow
an
cons-
idea to empower people to make decisions, because one of the things you found, Sylvester, with the problem you just identified, which is a terrible tragedy and an indictment of the system in Texas, by the way, is that if people don't have economic power to affect anything, they're dealing with a bureaucrat. If it's a bureaucrat in the insurance industry or a bureaucrat in government, it doesn't make any difference, at least not to me. You're still going to get this heartless, whatever will get to you attitude, and that's a major problem with the present system.
And competition, I will agree that when there is a competitive marketplace, when choices are made available, that will help to drive down prices. The question then becomes, how do you effectively devise or design a competitive system? Because if the system is not competitive, take the government out. If there is not a competitive marketplace, then what you will end up having few choices, and those who are making those choices drive the cost up, because you have limited choices. We have seen that happen on the utility side. It has happened on the utility side.
Yield the floor.
And the same thing will happen on the
You asked
healthcare
about
side.
a competitive system. What you need to do is to equalize the tax structure so that the taxes do not encourage employer-provided insurance. And therein lies the problem,
Deduction
really,
for the
of the
individuals.
pre-existing conditions. If you can have individual policies bought from anywhere in the U.S. and you can carry them with you through life, and then you can have catastrophic insurance policies and health savings accounts. And the lower premiums on the catastrophic policies will give the money for the savings accounts and whatever you want to throw in there. But then when you go to the doctor for your individual care, you decide based upon the true cost. And if there are people that we as a society want to provide free insurance for, give them the premiums to buy private insurance. Don't set up a government bureaucracy.
Why do we think that our system of health care is so great? Please explain this to me.
We have the most innovation.
We have a Harris poll out that has the Canadians say they prefer what they have 10-1 over us. We've got Britain.
But they only prefer it when they
and-
can come here. When
Britain
they're really
and France
serious.
Bingo.
think they are the envy of the healthcare world, and of course the World Health Organization ranks us way below them. So why is it that anybody thinks that we're doing such a great job?
Well, I think
The U.S. is the world source of innovation in medical equipment, in drugs, and those companies and those
Apparatus,
countries,
techniques,
I'm sorry,
training.
those countries benefit a great deal from our
So in other words,
subsidizing their
so we're suckers.
them.
We're
Foreign
suckers.
aid.
We're
We
suckers.
are subsidizing.
I think we have a.
And they wouldn't be so great without if the U.S. takes the road they took and we kill innovation here, they will suffer greatly just like we will.
Well, I think we have an excellent system in terms of innovation. I'll agree with you on that. I think we have an excellent system in terms of the quality of medicine that we offer with our doctors and technology. I'll agree with all of that. I think the problem is for those who can afford to get it, we have it and it's available. But for those who cannot afford it, the innovations are not made available to them. The technology is not made available
First
to
of all,
them.
many of the
absolutely
uninsured are
because
already
they-
insured.
because they- because
Malarkey,
they
and I'm
don't
gonna
have
put my
access.
foot down on this one. They do too.
How do they
Show
get
me
it?
somebody that didn't. Give me the name.
Devontae
Come on,
Johnson.
counselor, let's have it.
Devontae Johnson. who's
Devontae
not-
Johnson, I will go back and
14
check it.
years
I've been
old.
through Texas Children and seen the kids in there that can't even speak English to their families
And
outside
Ed,
looking,
and
and they're being treated
Ed,
in
I
ICU.
I don't question that.
believe it.
Ed, I don't question that. That these hospitals and medical facilities do an outstanding
His
job.
mother may have been incompetent to get him that help.
Absolutely,
I don't know.
absolutely not.
But that doesn't mean he was refused. He wasn't turned away. EMTALA is a program by which you have to give a kid or any adult all the medical attention they can if they go and ask for it, regardless of citizenship, regardless of their ability to pay, or if they speak English or not. That's the law, counselor. You have to recognize that.
These medical facilities
But
are
you gotta
being,
pay for that,
they're
though.
being overwhelmed.
Yes, they
They're
are.
being overwhelmed. They cannot see everyone who is in need. I mean, granted, I'm not talking
Well, that's
about
why the pricing structure's
but I'm not
messed up,
talking
too.
about a system for which I am not intimately familiar with.
Nor am I, Counselor.
The facilities that we are talking about are doing an outstanding job at servicing those who walk into their doors, but they are overwhelmed. They will tell you that they cannot treat everyone who needs their services.
So
why you
what
don't-
happens then, just hold that thought. You and
Okay.
I are in agreement again.
Okay.
Holy mackerel, the world stops. If they can't treat who's out there now, and we then expand it to every person without adding one more doctor, one more nurse, and we actually decrease the amount that they're paid under, hang on a second, under Medicare reimbursement rates, they're going to take Medicare plus 5%. That's what's in the House bill that you haven't read.
That-
Hang on a second. If that's then going to be what you get paid, how do you grow capacity to handle more people if then more people have access
Because
to
you
it?
need a comprehensive system.
You can't do it.
You
It
need
gets
a
worse. It doesn't
We
get
need,
better.
we need an answer here.
You need a comprehensive system from the medical schools where you're producing more doctors, you're putting more in the pipeline, you need more nurses, we need more doctors. One of the bills that we passed out in this legislative session, in which I put an amendment on, is a loan repayment program to encourage and bring about and produce more doctors. The infrastructure needs to be improved, no question about that. But to simply to imply that implementing tort reform is going to solve the problem,
No,
you
not
would
by
have
itself.
you would have thought that from 2003 to where we are in the state of Texas, that our healthcare system would be a heck of a lot better, and more people would be
It
made
is.
available.
It is better in Texas, by the
little
way.
to do
I
with
want
what you're
to
talking
go back to talk about what Ernie said we were going to be talking about, which is the politics of the medical crisis,
Yes.
as it were. Democrats versus Republicans. Obama basically subcontracts the bill to the House of Representatives and Pelosi. They come up with a bill that now they're kind of moving away from. Public opinion is moving against them. Politically, can the Democrats actually pass any kind of bill without any Republican support under the president's state?
Politically, the answer is yes. The numbers are there. Now, is that the preferred route? One would like to operate in a spirit of bipartisanship. At the end of the day, let me take the way I operate politically. At the end of the day, the people who send me to office want me to represent and address their needs. They don't care whether I'm a Democrat. They don't care whether I'm a Republican. What they know is that if they walk into my office from my district and they have a problem, they want the problem solved. Many of the people in my district need health care. They're without it. They want the problem solved. To say to them that, oh, the market will take care of it, the market will respond, or government is too big and
there's
cumbersome.
emergency room somewhere
Right.
for you.
To say to them that is not an answer for them.
So they want to have an insurance card?
What they want is that if they are sick, especially working parents, and we're talking about working parents, that if they're working, if they are following the Puritan ethic, they're waking up every morning, they're going to their jobs, they're taking care of their kids. If their kids get sick, they want to know that there's a system out there that will be responsive. That if they have private health insurance, that their insurance company is not going to drop them when their kid becomes seriously ill.
Well, that's got to go.
Or if they have a pre-existing condition, they're not going to
Let me ask Ed
denied.
and Cliff this question.
Everything you said is right, by the way.
Ed, let me ask you this question. You
It
and
is.
Cliff.
You're absolutely right. But the answer is not in the proposed plan, which we're talking about today.
It is not.
That answer is not there.
Well, here's one that is in
It
there, and you
should
can
be.
address it.
And let me
How
say
did
one
we
other
get? How did
thing.
we get to this point, Ed, where a section in the bill titled "Advanced Care Planning Consultation"?
Page 424 through page
A
430.
voluntary plan that reimburses doctors for talking about this
It's not
thing.
voluntary, it's
of course
mandatory.
it is. Of course it is. How did we get to the point where somebody could identify that as a death panel?
You'd have to ask that
that's
person.
That's going to be killing kids.
You'd have to ask
and
that person.
elderly people.
You'd have to ask that person. I didn't make that comment. My point is simply this. What is in that bill is not addressing the very real specifics that this gentleman laid out that are correct. And his constituency are my neighbors. I have empathy for this situation. We have to address this. What's in that bill doesn't address it. Whatever flashpoint hit on a Facebook page by Sarah Palin, you'll have to go to Alaska to get that answer. Let me finish this. On page 424 through page 430 are mandatory counseling sessions every 5 years through Medicare, where the person shall, the word shall is in there, and you as an attorney know that shall is mandatory.
It was offered by a Republican, by the way.
It doesn't make a difference. It's shall. And you can't find the person that put that in there. It should have been taken out on day one.
We have to do something about controlling costs of end-of-life care. That's where we're spending all of our money.
I don't think we should.
Do we not?
I went through this with three parents, my mom and dad and my wife's mother. In 18 months, we lost all three of them, and they were bedridden in the last few months, if not a year and a half of their life. And having the government come and counsel them as to how to put a needle in their arm to end their life is not what we needed as a family.
And that's not going to solve the problem.
It's
And
not.
they were on Medicare and everything. Everybody approves of Medicare.
I think in answer to your original question, what
breaking
the
this.
issue is we're moving from the standpoint of medical care, which is valued highly by individuals. Past food and shelter, health care is super important, and it makes a big difference in our quality of life. We're moving from an individual doctor decision making and some insurance intrusion, which we ought to change. But we're moving from this toward what's advocated is actually no focus on the individual anymore. It's a focus on the public good, and decisions will be made at the government level for not individuals but for the public. And this is where you get to Palin's probably death panel or whatever she said it was.
No.
I know. But the point is that in the last months of life, the expenses are very high. And if you want to control expenses, and gee, that voter's not going to be around very long, the quality of their life isn't that long if they're old, why not take a big chunk of this and put it over here to a whole bunch of others who vote for a long time, and look how many you please. And so,
Is that what's happening now? Doctors are making calculations about votes?
No, that's what is going to happen in this government
We're
system.
doing it.
And you
We're
may,
doing it right now. We're doing it
when
right
you
now.
say you have to reduce the expenses
What are we doing now?
in the
We are
last
looking.
year of
We are
life,
looking at the cost of providing health care from the beginning all the way through the end. We are making decisions right now.
Who?
Companies, as well as the government. Everyone is making critical decisions based on the cost. I mean, let's not.
People make decisions
but
all the
I'm saying,
time
but
about
let's-
everything.
But let's not fool ourselves. Let's not fool ourselves. If the status quo remains as it is, okay.
All right.
And
everyone-
that status quo is what we're
Everyone
left with
pays.
right now. Thank
Everyone
you, guys.
pays.
Dr. Fry, Ed Hendy,
Everyone
Sylvester
pays.
Turner.
Thank you.
Thank you all. And you can watch a discussion of tonight's show on HoustonPBS.org at Red, White, and Blue, so check that out. And until next time, get informed and get active.